Welcome everybody to our conversation with Meghna Patel, Deputy Secretary for Health Innovation at the Pennsylvania Department of Education. I'm Rose Belinsky, the Director of Teaching, Learning, and Innovation at the Delaware County Intermediate Unit. Thank you for joining us tonight. DCIU is excited to have the opportunity to spend time with you tonight, learning about the COVID Alert PA app with Deputy Secretary Patel. Before we begin, I would like to share the format of our conversation. After introductions, Deputy Secretary Patel will be sharing an overview of the COVID Alert Pennsylvania app. Following the overview, we will move into the question and answer period that Dr. Weatherhead and I will moderate using the questions that you've submitted. I'd like to take a minute to introduce Dr. Andrew Weatherhead, a teaching and learning specialist at the Delaware County Intermediate Unit. I want to thank Dr. Weatherhead for all his efforts and help putting this webinar together. After the question and answer period, we will end the program with closing remarks from Deputy Secretary Patel, and then I will close out the program. Now, I'm excited to introduce our key speaker, Deputy Secretary for Health Innovation at the Pennsylvania Department of Health, Meghna Patel. In her current role, Deputy Secretary Patel oversees the Pennsylvania Prescription Drug Monitoring Program, the Health Research Office, the Bureau of Managed Care, the Rural Health Redesign Office, the Primary Care Office, and the Bureau of Health Statistics and Registries. Prior to this role, Deputy Secretary Patel was the director of the PDMP Drug Office at the Pennsylvania Department of Health, where she launched and led the implementation of the Prescription Drug Monitoring Program Office system. She also directed the implementation of the fatal and non-fatal drug-related overdose surveillance program in Pennsylvania. Additionally, she led the development and implementation of evidence-based opioid prescribing education modules, which have been used to educate over 6,000 healthcare providers in Pennsylvania. Before joining the Pennsylvania Department of Health, Deputy Secretary Patel worked for the Geisinger Health System, managing and leading the International Classification of Diseases, the 10th version. She led the implementation for the entire health system. She earned her Master's of Health Administration from the University of Scranton. She is also trained in Lean and Six Sigma from Villanova University with a strong background in program management, process improvement, and strategic communications. She earned her Bachelor's of Commerce in Business Statistics and Advanced Accounting from Gujarat University in India. Additionally, Deputy Secretary Patel and her Pennsylvania PDMP office were the recipients of the Officers Award for Excellence in 2016 for building the state's prescription drug monitoring program from the ground up in less than 5 months. Quite an impressive resume. Deputy Secretary Patel, thank you so much for being with us tonight and sharing your expertise and time. Now I'm going to turn the program over to you.
Thank you, Rosemary. Definitely there was, thank you for the introduction. Definitely took me down the memory lane. In COVID-19, we forget sometimes we have so many hats to wear. So I hope you can hear me all. It is my pleasure to give you all a background today about a novel technology solution that we brought to Pennsylvania during such a difficult time of pandemic here, using a technology that basically two tech giants, Apple and Google, worked with a lot of states and countries across the world. So I am presenting today about Pennsylvania's exposure notification app called COVID Alert PA. You'll see me walk through some of the background today about how this app works. Hopefully you all have downloaded this app. At this point, the app was launched around September 22nd, so we're about more than a month and a half here since we launched. The app has over 457,000 downloads. If you go and download the app, you'll see how many people actually downloaded the app. It's right on the screen. But it is a cool technology to bring it up, but it intrigued us when we learned back in April and May at the department here, including myself and my team, that the two tech giants here, Apple and Google, they announced a joint effort to use a already embedded technology on all smartphones, which is a Bluetooth low energy technology. Again, like I said, all smartphones pretty much have this. And they wanted to leverage that technology to help and support the traditional contact tracing efforts. So in this app and in this technology of exposure notification, only Bluetooth is used. It is the same technology that is used to connect a phone to a car when someone wants to listen to music, or your headphone to your phone when you want to listen to music. This wireless technology can basically, it's a unique positioned technology. You can calculate time and distance. So based on a proximity, and if you're within that proximity in a certain period of time, you can get alerts if someone came in close contact with an individual who was tested positive for COVID-19. Now, this is an opt-in and voluntary app. Certainly not mandatory for anyone to download. We want and we are encouraging every single individual in Pennsylvania who's 18 and above to download this app. We're adding one more additional tool in the toolbox, which has the potential to save lives. I just mentioned something about the app. It is available only for individuals 18 and above. However, we've learned the challenges with the different types of population, especially individuals and younger kids from 13 to 17 years of age. We are working on a solution where this app would be available to that age group. Certainly that release will be made available of the app in the next few weeks. So coming back to my slides here, I wanted to also emphasize that there is absolutely no location or GPS or geolocation used in this app. The phone doesn't even enable any of that, and there's no means for the app to collect this information. When this was first announced by Apple and Google, they made it very clear that exposure notification must comply with strict privacy standards, and only state health department or a country's public health agency can develop such an app. So I'd like to explain briefly how this helps the traditional contact tracing efforts, and essentially also explain what traditional contact tracing is. So in Pennsylvania, we have used contact tracing as a tool to stop the spread of infectious diseases for decades. That happens with mumps and measles and all sorts of infectious diseases. It's not something that we started just because of COVID-19. We've used this method to reach out to individuals for many, many years. Now, today, during COVID-19, our disease investigators, they try to reach out to every single positive case individual in Pennsylvania. And they try to understand who they came in close contact with. Usually this is done so public health can reach out to those close contacts and alert them saying that they might have been exposed. So they can monitor themselves, go get tested, stay at home, and take precautions. Basically, they try to effectively slow the spread of COVID-19 and cut the chain of transmission as they alert the individuals, the close contacts. But precisely here's the problem that we were trying to solve by bringing an exposure notification mobile app. We realized that during these disease investigation calls, a positive COVID-19 individual could only name their family members at home, potentially their neighbors, or even extended family or friends when they tried to recollect who they came in close contact with. If this positive COVID-19 individual went to a grocery store or a food pickup line or a pharmacy store, and interacted with a stranger, probably not social distance, whom he, she, or they cannot identify or provide contact of, then the stranger who came in close contact with the positive COVID-19 individual had no idea that they were exposed. So this individual will go out and about carrying their routine work, completely unaware, and continue to spread the virus. So you can see in the slides here, as depicted in this graphic, not all close contacts are identified, especially if they cannot name the strangers or recollect who they came in close contact with. Hence why we're in global pandemic. So what we did when we saw Apple and Google make this announcement is we reached out to Australia, Singapore, Ireland, and Germany's health department. We wanted to learn basically how they were, since they were ahead in developing such mobile apps, we wanted to learn how they were implementing it. In that assessment, we realized that very clearly, Australia and Singapore were not using Apple and Google's privacy-centric exposure notification, while the countries that advocate the most on data privacy in the European nations, such as Ireland and Germany, were using the Apple Google's exposure notification service. And in the world of exposure notification, we all look up to Ireland and Germany because they're considered as gold standards of implementing such technology. So at this point, Ireland has about almost 38 to 40% of their population that has downloaded the app. And Germany has about 23 to 24% of their population that has downloaded the app. Now, here in US, in the absence of a nationwide app, states like us in Pennsylvania, we started to research and develop our own respective exposure notification apps. And specifically here in Pennsylvania, we kickstarted multi-state coordination meetings with our neighboring states. Very clearly, we know that Pennsylvanians don't stay in Pennsylvania. They cross state border lines all the time for a variety of reasons. Is it to access healthcare, to go to a grocery store, or even go to a job or their workplace? So we then partnered. Out of those neighboring states calls, we partnered with Delaware. We also started working with New York and New Jersey. And all 4 states, we partnered with a company called Nearform. It is the app developer for 5 other nations, such as Ireland, Northern Ireland, Scotland, Gibraltar governments. So Nearform was very uniquely positioned to help us because they had an experience launching this app in other countries. And that experience mattered because this was a novel technology that has not been implemented ever before pandemic. So Nearform was selected. They also had a very successful country-to-country interoperability, meaning individuals going from Ireland to Northern Ireland can seamlessly use Ireland's app and vice versa. They did not need it to download an app from Northern Ireland. So they made it very easy for individuals in case if they're traveling. We also wanted to make sure that this app is open sourced. And for the non-technology individuals, what open source means is that you basically have the entire coding of the app open to public, open to technology experts, to scrutiny, and as much as of investigation that they want to do, they could. And so we wanted to make sure that for the privacy reasons that we made this app available open source. So all of our technology experts or academic partners can fully go into the coding and see what data is collected, what data is shared, how it is shared, how the data has been transferred, and all of that. So those were some of the features that were very important to us. What we also did, we partnered with academic institutions. So as you see here on the side, we partnered with University of Pennsylvania's Center for Health Incentives and Behavioral Economics Group. They brought their behavioral economics research experience. We wanted to make sure that as we launch this app, we wanted to understand how they can help us with messaging and marketing efforts. As you all know, we pretty much live in the misinformation epidemic. And so we also wanted to understand the social media misinformation. Certainly there was a lot before and after the app launch. And just understand the public concerns about the app. Do they understand the simple language of the app, or how we can increase the user adoption? Then through the sponsorship of the CDC, we also work with Massachusetts Institute of Technology, MIT, MIT's Lincoln Laboratory, MIT's Computer Science and Artificial Intelligence Laboratory, and MIT's Internet Privacy Research Institute. This group of MIT academic was advising us as the technology advisors. They were also brought on board to review the privacy and security of the app. And certainly they have done that assessment very well. And then finally, we know that, like I said, Pennsylvanians don't stay in Pennsylvania. They go and cross the borders all the time. And at the end of the day, since in US, every state is coming up with their own app, we don't want individuals to have 50 state-specific apps on their phone. And just imagine that. I don't think anyone would love to do that. So we worked with Apple and Google, and we're still continuing to work with the Association of Public Health Labs, which is a national interoperability platform. And so through that, Pennsylvania's app, as you can see here on the slide, Pennsylvania's app can seamlessly work in Colorado, Delaware, Nevada, New York, New Jersey, North Dakota, North Carolina, Wyoming, Washington, D.C., and then 4 other states are working on their pilots. As soon as they are implemented, Pennsylvania's app can seamlessly work in those states, meaning you don't have to go and download that state-specific app when you travel. So that's very important for us. Next, I wanted to go through some of the limitations of the app. So how does this Bluetooth technology work? And certainly it is not a magic solution. It has limitations. An extensive study was done by Trinity College in Dublin, Ireland, where they looked at all different types of real environment scenarios and where the Bluetooth and this technology would work seamlessly. And out of all those different real environment scenarios, they flagged one particular one, which was a reaction of Bluetooth technology and the wireless detection when it's under a closed metal environment. So imagine your bus with a closed door and window, or a subway with the closed doors and windows. In those settings, the testing showed that even if individuals were sitting farther than 6 feet apart, it showed them as closer than 6 feet. And then also, while this study was conducted, even though this was a sort of a negative test result, what they concluded at the end of this is because it is replicating an indoor setting, meaning this is closed door and window, subway or bus, that it is still best to err on the side of the caution and give individuals an exposure alert if they ever came into contact with an individual who tested positive. So that was very important. And I think we wanted to factor that as well and lift that up to everyone as we educate about the app. The app, the Bluetooth, and the phone doesn't know if you're wearing a mask. So if 2 people are within 6 feet and if they're wearing a mask, they might get an alert. It certainly doesn't know that. And if 2 phones are on a desk, but the individuals are separated from each other 6 feet apart, obviously the phone doesn't know that. So in those cases, yes, the phone will definitely give an exposure alert in case one of them turns out to be positive later. And then this is our biggest limitation that certainly I myself and my team, we go out and reach out and talk to every single one of them, how to go to the right source for information, especially when it's a technology solution. The public trust of the technology has been a biggest issue. So as I show you today how this works, or if you have any questions and I help you address them, It's very important to look at the right sources of information and break the sort of bust the bubble of misinformation spread about that government is out here to take information from everyone, which is not the case. The app doesn't collect any of that information. So those are the limitations. Now, in my next slide, I have two sort of images coming up. What I will do is I will give you a very simple example here, and hopefully you all will understand how this app works, and I'm very much pleased to take any questions if there's any concern of not understanding how this app works. So for this example, you will see on the graphic here, let's assume that Bob and Alice are strangers, and they are sitting on a park bench, and they both have the apps on their phone. They're sitting on a park bench. This is within 6 feet, and they talk to each other for 15 minutes or more. In the background, what happens is their two phone devices exchange a Bluetooth handshake. What that means is when they signed up for this app and the exposure notification service, their phone is masked with a random alphanumeric value. And those values keep on changing every 15, 20 minutes. So there's no way to locate or identify anybody in this case. And that's the technology of that app on Google that I was talking about. So in the background, the two phone devices exchange a Bluetooth handshake. In other words, their sort of Bluetooth keys were exchanged. After that interaction, they go back to their normal life. Few days later, Bob tests positive, and Bob gets a phone call from a public health case investigator, goes through the case investigation process of when did he start with his symptoms and all of that, and asks if Bob would be willing to validate through the app by providing a unique 6-digit code that Department of Health will provide. Bob says, yes, I'm willing to alert others that came in close contact with me. And the case investigator will send a 6-digit code via text message to Bob. And when Bob confirms this through the app, which is the next slide, his alphanumeric value, which is the Bluetooth keys that I mentioned, there will be flagged as positive. And in the background, it will check and bounce off with who, in this case, Bob had an interaction with someone 15 minutes or more. And then all those individuals, if they are confirmed, if they had an interaction 15 minutes or more, will get an alert. It's a notification alert. And it happens within the app. It's not a text message. The notification happens within the app. And in this case, if Alice was close enough to Bob, talking for 15 minutes or more, she will get a notification saying that you came in close contact with someone who was recently tested positive. It doesn't say who. It doesn't say where. It just anonymously tells Alice that she's come in close contact with someone who was recently tested positive. What happens is then through the app, there will be public health advice provided to Alice of what to do next and how to take care of yourself and protect others. If Alice is now worried that she got an alert and she wants to talk to a public health representative, we also give an option for individuals like Alice who got the exposure alert to put her number or provide her number for callback, and we call those individuals back within 24 hours. So this is very simple, and as you can see, what happened here, if you can just recollect how that interaction happened. In the traditional contact tracing, Bob was interviewed, if Bob was interviewed for contact tracing in that process, he wouldn't have remembered Alice's name because Alice was a stranger. She sat with him on the same bench. They just had a 15-minute chat. Alice was exposed. And in this case, Bob would never be able to remember Alice's name or describe her. And nobody would have contacted Alice that she was exposed. And Alice would go out and about doing her work without knowing that she was exposed. And essentially, this is where the spread of COVID-19 has increased rapidly. So our tool here that we have is essentially helping stop the spread of COVID-19, but also giving this information tool in the hands of individuals that they can take next steps and actions if they get an alert. So that's how it works. It's very simple. In my next slide, I wanted to update all of you that we do have all of these countries that have used Apple and Google Exposure Notification Service. Switzerland was the first country to go live. We have a good amount of data coming out from Switzerland to learn how this is effective and helping the traditional contact tracing process. Keep in mind that this tool does not negate the fact that traditional contact tracing is still needed. It just helps augment the traditional contact tracing process and makes it faster. Recently, United Kingdom went live, and there are most other countries coming up live as this technology has been used across the board. And in the US, in my next slide, you'll see these are the states that have went live so far, and more states are coming on board as they go live with the exposure notification service. So in my next slide, my sort of closing, semi-closing presentation remark is that you all will have all the information that you need about this app on pa.gov/COVID. There is a special section for COVID Alert PA. Anything or pretty much all the social media toolkits or resources around promoting the app are also made available on that section of the page. And how this app works, there's a short video about how this app works, but also, you know, if you have questions about the app or want to talk to a app genie, who we call app genies, you are most welcome to call and learn more about the app, as well as also reach out and email to learn more about the app if you have any questions. There is a very detailed data and privacy policy. We've made sure that every individual knows what type of data is collected and what data they can share. And so all of that is made available. Like I said, again, there's no location information being collected, no identifying information is collected. It is all anonymous, it's all voluntary, and it's an opt-in solution. So we all can use this technology. We're in 21st century, we're soon be going in the next century, and so we need to adopt these new technologies to see how we can stop the spread of COVID-19. And so that's my presentation at this time.
Thank you, Deputy Secretary Patel. What a fascinating, positive use of technology. It's so exciting to see how many people have come together to make this happen. Deputy Secretary Patel, if a person right now wanted to go out and start using this app, what's the quickest way for them to access the app and get started?
So any smartphone, if you have an Android phone or Apple phone, you can just go onto the Google Play Store for Android phones and Apple App Store for Apple phones, and just search COVID Alert PA. Once you type in COVID Alert, you'll actually see like 5 different types of apps. You'll see a New York's app, New Jersey's app, Canada's app. But if you're in Pennsylvania, you need to download Pennsylvania's app. So it's COVID Alert PA.
Okay, thank you. Deputy Secretary Patel, can you please talk about the daily check-in feature?
Yeah, absolutely. So, and I also don't mind to show exactly how it works. I don't know, Dr. Weatherhead, if you want to bring the slides up again, I'm pleased to walk it through.
1 second, let me reopen those.
Yeah, take your time. So while you're doing it, what I can say is it's an independent feature in the app. It is a feature that anyone can use to assess their own symptoms and just track the symptoms each day. So I'll give you my example here. I check in my symptoms every single day. And so you can keep going down the slides. I can show you how the screen looks like. Continue with, yep, continue again. I think 2 more. Actually, continue again. 1 more, thank you, that's it. Sorry about that, I should have managed that here on my end. But Essentially, it's an independent feature, like I said. COVID check-in feature allows, so it's beneficial for individuals, so they can just every day go in and check whether they're feeling good or they're not feeling good. And if they're not feeling good, we list out all the symptoms here that are aligned with the Pennsylvania and CDC guidance around the symptoms of COVID-19. And they can basically every day just track those symptoms on their phone. For up to 28 days, it stays on the phone device itself. If they ever leave the app, I mean, all that history goes away. But let's say if I check in every single day and at some point I actually don't feel good, I can go back and look at the app and look at the track record and see exactly which day I said I'm not feeling good. Sometimes that helps with, if you become positive, sometimes that helps either your provider, your healthcare provider, your physician, your doctor, or even your public health case investigator to let them know when you were not feeling good. You usually don't remember off the top, but this feature is available to basically anyone to use. It's not necessarily only for positive individuals.
Deputy Secretary Patel, does this certainly this information is important to the user, and it helps them reflect on their health and see their patterns. Is the Department of Health able to use this information anyway to help understand the daily landscape of COVID-19?
Yeah, it is helpful. It's not just one data point, it adds to all the different data points that we collect. So we look at cases, we also look at hospitalizations, we look at visits, but this data is self-reported by individuals in Pennsylvania. We always take it with a grain of salt. I mean, we know that this is not fully accurate, but to the most accuracy we can take it, we know that as individuals select their demographics, again, they don't have to select the demographic. They can completely bypass the selection of their age range or which county they belong from and whatsoever. But we realize that if in a particular day, if a 44,000 check-ins happen, which if you download the app, you'll see it's anywhere between 37,000 to 44,000 individuals that have checked in each day. We always see the percentage of how many people feel good and how many people don't feel good. And if people select they don't feel good, we like to see what are the common symptoms people are seeing. In most cases, it's cough. In most cases, it's runny nose. And that gives us some indication of what are the symptoms that are most commonly seen if they turn out to be COVID-19. And so this information helps in a lot of ways to understand, like, what are these common symptoms occurring when we see more COVID-19 cases.
Thanks so much. During your discussion, you spoke a little bit about what it looks like if you get a notification. I was wondering if you could describe a little bit more for the end user experience when someone is notified that they've been in exposure range with another person.
Yeah, absolutely. Dr. Weatherbed, I might indicate again to go back to the slide. I actually have a visual, which normally people would not be able to see if they download the app, but that visual is available. I'm happy to walk through when someone gets an exposure alert. It's very unique. So while Dr. Weatherbed, you're putting it up, I can walk it through. So essentially, let's say you got an alert. If you keep going down, one more slide. There you go. I think that's the one. Yep. So this is a workflow where a positive individual gets a call from case investigator, Department of Health. They upload those 6-digit codes, and with their permission, they upload their random IDs. So in the next slide, actually, you'll see that if, let's say Bob actually did that previous work of uploading 6-digit code, in this case, this is the screen that Alice might see in my example that I shared before. It will show up as a notification on your phone. It says COVID-19 exposure alert. Please tap into the app, and it won't right away show you got an exposure alert, but it will indicate them to look into the app. As they go into or tap on that notification, a screen would show up that says exposure alert. And as you can read in this, it will say the COVID-19 PA app has detected that you may have come in close contact to someone who was recently tested positive. But it also will give you when you came in close contact with it. It might be a date. And that date will give good enough instruction to you as the individual who got the alert, but also when you speak with your healthcare provider, they will know that whether you need 14 days of quarantine or might be like 12 days of quarantine or 10 days, because that's your exposure date that you had an exposure with this individual. There's two sort of options we provide. As you can see, there's an option of exposure information, and if they click on that, they will get a series of instructions of what they need to do. In this case, like isolate, take quarantine measures, go get tested, all of these instructions. Don't go out in like social gatherings and so forth. Just try to monitor your symptoms. The second option, if once they read it, and if they, like I said, they want to speak with a public health representative, they can click that, put their phone number in, a callback request is generated to the Department of Health, and we try to reach out to this individual in 24 hours. And when we reach out to this individual in 24 hours, if they've got an exposure alert, we put them through traditional contact tracing as a close contact process.
Hey, thanks so much. It's so exciting to hear that our neighboring states are using COVID-19 alert, and that it sounds to me like they're talking to each other. So if we have ours downloaded and we're traveling across the border to Delaware or New York, that's very exciting, especially in our location of Delaware County. So how do you see this affecting, how do you see this affecting people that are using the apps, that are crossing borders? Maybe they live in New Jersey and come to Pennsylvania for their job, or vice versa.
Yeah, I mean, like I said, especially in Delaware County, you in the tri-state area, people cross a borderline within the 4 miles. They could go to Delaware, or they could go to New Jersey and come back. And that could be for a variety of reasons. It could be, like I said, you went to a restaurant and picked up the food, or you accessed a healthcare service and your provider is in a different state. From the beginning, we knew that we could not bring a solution just for Pennsylvania. We had to think through the individuals who travel across state borderlines all the time. And now we hope at this time that we have worked out the situation between the 4 states, but more and more states should implement this technology and make it interoperable. So even if individuals fly to another state, which, for valid reasons, if they do that, not just for leisure, but that they can, if they ever got exposed, this technology can alert them. Even they got exposed in New Jersey, they can still get an alert here on the Pennsylvania app that they got exposed. That kind of interoperability is very important when, we want to know where we go, and if we got exposed, we want to take the measures right away. And this is kind of like the tool to get that action expedited.
Okay, thanks so much. When we think about this time of misinformation epidemic, as well as a virus epidemic, people are so concerned about their privacy. Could you just highlight a little again how people's privacy is protected, what that mechanism looks like?
Yeah, absolutely. So I'd like to highlight again the detailed data and privacy policy that we have provided. But if somebody doesn't want to read all of that, the app already has a data and privacy section. If somebody clicks on that, they will be able to read it. But there's 3 types of data points that we collect. One is app usage. meaning, and that's again, it's people's choice. They can simply turn that off if they don't want to share app usage statistics. But in most apps, all mobile apps pretty much, sometimes they ask, sometimes they don't ask, they just collect it. But what we want to know is whether the app crashed when somebody was downloading this app, so we understand how many errors were happening when an app opened and it crashed, it didn't work. We also want to know if someone went through the onboarding and something got deleted, that the screen doesn't show up. So those all are the app usage statistics. How many clicks or how slow is the app going from one screen to the other? Those are the app usage statistics that we like to calculate. I mean, it's kind of like a performance of the app. Is the app doing its job? Is it fast enough? It's working or not? Again, that's the choice for everyone to use it. There's no name or any identifying information, any such collected. It's just how the performance of the app is. The second piece that we collect is check-in. And as you saw in the check-in feature, it asks for age range, which county they're from, what's their sexual identity or gender identity, sexual orientation. And those are the data points which are very generic and aggregate. It doesn't identify anyone because it's based on a range. And if individuals are not willing to select it and just bypass it and you still use the check-in feature, they can do it. They're all optional data points. And the third sort of data point that we collect is as we realize that alerts are going out and as individuals request for a callback, that's the only time we know somebody got an alert. We only know how many alerts went out. We don't know who they went out to. So in that callback feature, at that point, when the individual shares their phone number, that's the only point we reach out to them. So those are the only data points that we collect. Again, this service from Apple and Google and this app has been so open source and available for anyone to check how and what data we collect. There's absolutely no location information collected. Bluetooth cannot trigger location. And all of that is very anonymous. And so those are the only data points that are collected. I will tell you, I mean, the social media apps and other apps do collect a lot of more information. This doesn't collect any of that.
Thanks so much. Deputy Secretary Patel, are there any situations or environments where a user should turn off the app?
I mean, if they are if employees are in a very closed-knit setting, so I'll take lab as an example. In a laboratory, if individuals are working very close enough together, they might have phones with them, but they always have their own personal protective equipment on. So they have their PPE, they have all these other protection on, where even though they work very closely in a setting, they don't, need to, in a way, use this. They're very well aware if someone gets positive, it will be circulated around, and proper protection will be taken, and proper quarantine measures will be taken. I mean, in those settings, I could see them not using it, but if they go out and in their normal life outside of their work setting without PPE, then definitely it's recommended. They can still keep it on, and even if they get an alert and they realize that it is from to someone who tested positive in the work environment, is still good to have. I mean, they will always know it anyways, but it's still just beneficial. It's just like one added thing that they will get an alert on.
Thanks so much. Dr. Weatherhead, I'm going to turn it over to you now.
Thank you. Before we moved on, actually, there's something in your presentation I wanted to follow up on. You kind of gave a teaser about the app coming out in a couple of weeks for people of the age of 13 to 17. And so I've been kind of curious and wondering if you might talk a little bit about, how that is different than the app that's out. Will it have different functionality? Do you see it being used from a user experience standpoint differently, so that those who might already have the app and have children might start to think about, what that app might look like for their children?
Yeah. Yeah, I think just to let you know a bit of background about, we had this app for individuals 18 and above for a reason that when we do case investigation of positive COVID-19 individuals or contact tracing, if they're under 18, we would not have those without a guardian or a parent giving the permission. So we kind of wanted to apply the same thing here. So as you know, there are COPA laws, federal COPA laws and federal minor HIPAA laws that prevent us from creating such a solution that's available for individuals under 13. Absolutely, we cannot make anything that's under 13, but also keeping the under 18 and minor HIPAA laws in mind. We brainstormed with our lawyers, and we also heard from the community where parents were concerned about their, kids. They wanted to have this app for them, but it's not available for them. So what we will do now, and I hope we have this in the next 2 weeks, but it could be end of November here when we release it, but essentially allow parents to consent through the app. It's a parental consent. So if they select I'm under 18, they will get a pop-up and say, if they're between 13 or 17 years old, they need a parental consent. And if parent says I confirm, they can go ahead and use the app. So it's important that we get the parental consent. So our hope is that parents that are very concerned about their kids between 13 to 17 who couldn't use this app could use the app in that case.
Thank you. I was wondering, it kind of in a broader lens of contact tracing, for many of us, we'll never experience it or, be the recipient end of it, but whatever you might talk about a little of the science behind it, or even just the flow of it. The diagram you shared kind of showed an initial contact and the tracing that branched from it. And so as a follow-up also, is it used to trace backwards and forward? Do you look for patient zero, so to speak, the person who infected the person, and does it then trigger down the line as well?
Yeah, so I mean, if we're not in a global pandemic, the contact tracing would have been very much successful. It is still successful to the extent it is possible, but quite frankly, today in Pennsylvania, we had 5,400 cases positive. And so imagine calling every one of them, trying to understand from every single one of them who they came in close contact with, and then try to call all those contacts, which could be twice or thrice the amount, and tell them that they might have been exposed. So that not only creates a burden on the contact tracers and the level of investigation that we need to do, but in the pandemic, that's concerning. Now, that is an effective tool, quite frankly, to stop the spread of COVID-19, besides testing and other precautions and safety measures like washing hands and social distancing and wearing masks. But contact tracing itself is very, very effective. There are many, many studies done, and we've been doing this for decades and decades. For any infectious diseases, this is the best route to try to reach out to those contacts, stop the chain of transmission, put a pause basically and say, hold on, don't go out and expose yourself, because then others will get exposed. And it's like that R0 transmission that will go increasing and increasing. So, I mean, there are several studies that have been coming out how it has been effective for COVID-19, but there are many, many peer-reviewed journal articles since, quite frankly, 20 years that have said contact tracing has really, really helped in stopping the spread of, basically cutting the chain of transmission of any infectious diseases.
Thank you. Something else, I think when we all think of Pennsylvania, we know that we are diverse in many ways. And I'm wondering if you might speak a little to the challenges of a wide-scale deployment of an app across a state like Pennsylvania, where we have issues like rural versus urban areas, highly dense areas versus areas where there may not be good cell signal, good internet connectivity. What kind of challenges do those pose, and how has your office been brainstorming ways to overcome those?
Yeah, I mean, we've talked about this, and I think there are many studies that have been published as well of how this one technology solution is not a fit for everyone. I mean, you can think about older individuals and adults that might not have a smartphone. I mean, I talked to you about the challenge of under 13 who would not be able to access this. This app usually is only using Bluetooth. The only time it is using Wi-Fi or any sort of internet connectivity is when you download the app. And it just works seamlessly in the background. You don't have to keep it open. It doesn't need, quite frankly, internet connection because the Bluetooth does its job. If two phones are close enough, the Bluetooth detects it, does the proximity, does the measurement of the time, and that's it. When someone has to get an alert or someone will get an alert, at that point, I think the connectivity is needed. So usually those alerts go out once in 24 hours. And, you know, it has been tested through, when we did our pilot, it has been tested through some of the state agency partners from DCNR who are out and about in remote areas in state parks. And we've also tested this with PennDOT staff who are on the road doing their jobs. And then we also tested it with 2 academic partners like Penn, and we also tested it at Geisinger. So like we tried to do a lot of urban, rural, suburban setting testing, and it did work in the cases where we, you know, purposely through technology infected them as COVID-19 to test it how it was working. And it worked pretty fine without any glitches or concerns. But that's the best part, that it's not using your internet or Wi-Fi all the time. It just needs Bluetooth in the background.
I was wondering too if you see use cases or scenarios where businesses or nonprofits or even community organizations are using the app to try to either alert themselves or keep their own employees and workers safe. So beyond just individual use, but larger organizational use.
Yeah, so when we launched it, and I will give a huge amount of kudos to our marketing and communications team, because they reached out and we realized that no matter how much of paid media we will do on social media, people still like to hear from word of mouth about the app, and grassroots movement about talking about the app and having people to commit to download the app was very important. So we reached out through our Department of Community and Economic Development, a lot of businesses, a lot of universities, a lot of schools, a lot of colleges, and promote the app as much as possible. So again, it's voluntary, but if it's coming from an employer, it's a good thing to do. It's almost like washing hands, you know, social distancing and wearing a mask. This was one another message that we wanted to make sure that every single employer or, you know, academic partner emphasizes to their staff and employees and students to, hey, you need to do this just to help stop the spread of COVID-19. So, I mean, we've seen University of Pittsburgh, we have seen Penn State, they have done literal newsletter and promotions to have all their students and faculty staff members to download the app, and we're very pleased with that. We encourage all of them to do the same thing. All of our state agency partners also did the same thing. So you'll notice that when this was launched, all of our state agencies made a joint effort shifting the same message that, hey, this app is available, download it. So we hope people download it, and we hope that everyone takes an advantage of this.
Yeah, I think we have, we're about 5 minutes left. So I think we have time for one more question, and then we'll do some closings. But I do want to shift the questions to kind of the area of just careers and jobs, because I think for us, looking at your slides and the wireframe layouts, I couldn't help but think of, you know, some of our student events we run where students will be doing hackathons and designing apps for a need. And what I would like to ask is just, you know, what kinds of jobs, what kinds of careers were involved in the bigger piece of this app development for the, you know, the person who looks at this and says, this is something that I might see myself doing as a career. Who are those people? What were the diverse people involved in this?
Yeah. So first of all, I was the lead of that. I was just following the story of Apple and Google, and I was very intrigued by that. I have zero IT background. I have a business sort of majors, and then healthcare administration and public health is my job. And I'm not an IT person by any means. I can say it fluently. But this was so simple that I could understand it. And then I started involving a project manager, a business analyst. We certainly wanted to have our marketing communications, folks who could understand the UX, folks who could understand like how visually this looks like. Do people understand the sixth grade language we present? Because sometimes we set into a public health mind and we say words that normal people who don't understand healthcare would never understand it. Like it would just go away. So we wanted to try to involve some of that UX picture, ensure we have a project manager, a business analyst, people who can test the technology and see if it's working the way it's supposed to work. And then certainly, anytime we'd love data feedback, so data analysts or data coordinators are really another good role that we're involved in here. Kudos to our information technology group that did a thorough review of the app, and we relied a lot on academic partners, as I said earlier. We relied on MIT and we relied on UPenn because we had very short amount of resources. Quite frankly, I can say this to you, but only 3 people were involved at the launch of this app when we worked almost 16, 17 hours a day. So at the beginning, it was just a lot less amount of people. Now we have operational staff who manages day-to-day inquiries from general public. And those skill sets are just, business management, but also like project management and all that kind of skill set. I hope that answers.
Yeah, it did. Well, thank you very much. I think we'll turn over to Rose to.
It's been a wonderfully enlightening evening. I want to thank all the community members for joining us, and a special thank you to Deputy Secretary Patel for spending time with us and sharing your expertise. COVID-19 continues to present us with many challenges. Learning about the COVID Alert PA provides our community members with another tool to mitigate the dangers of the virus. Working together, we will reduce the spread of COVID-19. Thanks so very much. Everybody have a wonderful evening.
Thank you.
Everyone.